After years in surgery, I can tell you this. Most falls in seniors don't happen because of bad balance or clumsiness. They happen because of one specific muscle weakness almost no one is checking. And the scary part? You can feel strong and still be at high risk. I've seen it countless times. Someone comes in after a fall and they tell me the same thing. I don't understand. I was just standing there. Or I was walking like I always do. And when we assess them, it's almost always the same hidden weakness showing up. Stay with me until the end, because I'll show you how to quickly test this muscle at home and how to start fixing it safely today. Before we go any further, I need to be clear about something. This video is for educational purposes only. It does not replace medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider before starting any new exercise or rehabilitation program. What I'm sharing today is based on established clinical research, but your individual health situation is unique to you. I'm speaking from a surgical and clinical perspective, working with older adults before and after falls, fractures, and joint replacements. I've stood in operating rooms repairing hip fractures that could have been prevented. I've had conversations with families in waiting rooms, trying to explain how a simple fall changed everything. And I've also had the privilege of working with patients who caught this problem early and completely turned their risk profile around. What I'm about to explain is widely recognized in orthopedic surgery, geriatric medicine, and physical therapy research. This isn't some new theory or experimental approach. It's something we've known for years in the medical community, but somehow it rarely makes it into everyday conversation about fall prevention. So here it is. The number one muscle weakness causing falls in seniors is gluteus medius weakness. This is the primary hip stabilizer, and when I say primary, I mean it's doing a job that nothing else in your body can fully compensate for. Now, you might be thinking, I've heard about weak legs causing falls. I do squats. I walk every day. And that's great. But here's what most people don't understand. The gluteus medius doesn't move you forward. It keeps you upright when you stand, walk, turn, or step to the side. Think about it this way. When you're walking and you lift your right foot off the ground, what's keeping your left hip from collapsing? What's preventing your pelvis from dropping to the right side? It's the gluteus medius on your left side, working every single second of that step. If it's weak, your body sways, your knee collapses inward, and your balance system is overloaded. Your brain is trying to compensate. Your ankle is trying to compensate. Everything is working overtime, and that's when a small trip becomes a fall. Let me break down exactly where this muscle is and what it does, because understanding this changes everything. The gluteus medius is located on the outer hip, right along the side of your pelvis. If you put your hand on your hip bone and slide it back slightly, you're probably touching it right now. It stabilizes the pelvis during single leg stance, which sounds technical, but really it just means it keeps you level every time you shift your weight. And here's the critical part. It activates with every step you take. Not just when you're exercising, not just when you're climbing stairs. Every single step. Walking to the bathroom at night, reaching for something in a cabinet, getting out of a car. This muscle is working constantly, and when it's not working properly, every one of those movements becomes a potential fall risk. What research shows is really compelling. Study after study has found that reduced hip abductor strength is strongly linked to falls in older adults. We're not talking about a minor association. We're talking about one of the clearest predictive factors we have. Weak gluteus medius increases lateral instability and trip risk, which means falls to the side, the kind that often result in hip fractures. And here's something that surprised even me when I first looked into the research deeply. This muscle is commonly undertrained compared to quads or calves. People do leg exercises. They feel like they're getting stronger, but they're missing this critical stabilizer entirely. Now here's what makes this so insidious. You can walk, climb stairs, and even exercise, and still have a weak gluteus medius. I've evaluated patients who are active, who go to the gym, who feel perfectly capable, and when we test this specific muscle, it's significantly weak. How does that happen? Let me walk you through the common reasons, because once you hear them, you'll probably recognize at least one in your own life. First, sitting too much. When you sit, this muscle essentially turns off. It's not engaged, it's not working, and over time your nervous system forgets how to activate it properly. It's not just about the muscle getting smaller, though that happens too. It's about the communication between your brain and that muscle getting fuzzy. Second, over-reliance on walkers or chairs. I understand why people use these aids, and they absolutely have their place, but if you're constantly holding on to something when you move, that muscle never has to work at full capacity. Third, exercises that avoid side-to-side motion. Think about the most common exercises people do. Forward walking, squats up and down, lunges forward and back. All of those are primarily working in one plane of motion. The gluteus medius works in the lateral plane, the side-to-side plane, and if you're never moving that way, you're never training it. And fourth, past hip, knee, or back pain, causing compensation. This is huge. When something hurts, your body is incredibly clever about finding ways to move without using the painful area. But those compensations don't go away when the pain does. You might have had knee pain 5 years ago, and your body learned to walk slightly differently to protect that knee, and now you're walking in a way that completely bypasses proper gluteus medius activation. This weakness quietly steals stability before it steals confidence. By the time people notice something's wrong, they've usually already had a close call or an actual fall. So let's talk about how you can check this for yourself. And I want to be really clear. This is not a diagnosis. This is just a red flag worth addressing, an awareness test you can do at home. Here's what I want you to do, but only if you feel safe doing it. Stand near a counter or wall, something sturdy that you can grab if you need to. Just knowing it's there changes everything in terms of safety. Lift one foot slightly off the ground, just an inch or two. You're not trying to do a flamingo pose here. Just lift it enough that all your weight is on one leg. Now notice what happens. Does the pelvis on the side of the lifted leg drop down? Does your body lean heavily to one side? Do you feel unstable almost immediately? If any of those things happen, it's often a sign that the gluteus medius on your standing leg isn't strong enough to hold you level. Try it on both sides, because it's very common for one side to be weaker than the other. And again, this is educational. You're not diagnosing yourself with anything. You're just gathering information about how your body is currently functioning. Some people do this test and they're rock solid. Others are shocked at how quickly they feel unstable. Both responses are useful information. Now, the part you've been waiting for. How do you fix this? How do you actually strengthen the gluteus medius safely and effectively? The key principle I want you to understand first is this. The goal is not heavy resistance. It's proper activation and control. I see people all the time trying to add weight or resistance bands immediately, and they end up using the wrong muscles to compensate. We want to wake this muscle up first, teach it to fire correctly, and then gradually build its endurance and strength. Let's start with the most foundational exercise, one that's been validated in countless physical therapy studies: side-lying hip abduction. Lie on your side on a firm surface, like a yoga mat on the floor, or even your bed if it's not too soft. Bottom leg slightly bent for stability, top leg straight. Now slowly lift that top leg toward the ceiling, keeping your toe pointed forward, or even slightly downward. The most common mistake here is letting the toe point up toward the ceiling, because that shifts the work to a different muscle. Keep the movement small and controlled. You're not trying to kick high. You're trying to feel the outside of your hip working. Do this slowly, hold for a second at the top, then lower slowly. If you can do 10 of these with good control, that's a great start. If you can only do 3 or 4 before you feel fatigue or your form breaks down, that's okay too. That's your starting point. Second, supported lateral stepping. This one is incredible for real-world function because it trains the exact movement pattern you use when you step to the side in daily life. Stand next to a counter or sturdy chair, one hand lightly resting on it for balance. Step to the side with one foot, then bring the other foot to meet it. That's it. But here's the key. When you step, focus on keeping your hips level. Don't let the pelvis drop on the side you're stepping toward. This is harder than it sounds, and it directly trains the gluteus medius to do its job during movement. Step side to side, slowly, with control. 5 steps in each direction is a good start. Third, standing hip stabilization with balance support. Stand facing a counter, both hands lightly touching it. Shift your weight onto one leg and slightly lift the other foot just off the ground, like we did in the self-check. But this time, hold it. Try to hold it for 10 seconds, focusing on keeping your hips level and your body upright. This is an endurance exercise for the gluteus medius. It's teaching that muscle to sustain its work over time, not just fire for a quick movement. As you get stronger, you can progress to using just one hand on the counter, then just fingertips, and eventually no support at all. But that progression might take weeks or months, and that's completely normal. Here's what's critical about all of these exercises: slow movements, pain-free range only, and support nearby at all times. If something hurts, stop. If you feel unsteady, grab that support. There is no prize for doing this without help. The prize is building strength safely, so that 6 months from now, you're more stable and more confident than you are today. So why does fixing this specific muscle reduce fall risk so dramatically? Let me explain what happens in your body when the gluteus medius wakes up and starts doing its job again. Your pelvis stabilizes. That means when you stand on one leg, even for a fraction of a second during walking, you're not wobbling. Your stride improves. You're able to walk with a more normal gait pattern instead of compensating, which means less stress on your knees, less strain on your ankles, and better overall efficiency. And critically, your balance system stops overworking. Your balance system is incredibly complex. It involves your inner ear, your vision, the sensors in your joints and muscles, and your brain processing all of that information in real time. When one part of the system is failing, everything else has to work harder. If your gluteus medius can't stabilize you, your brain is relying more heavily on vision, which is why falls often happen in dim lighting or at night. It's relying more on your ankles to make constant tiny adjustments, which is exhausting for those muscles and makes them more likely to fail at a critical moment. When you strengthen the gluteus medius, you're essentially taking pressure off all those other systems. You're giving your body the foundation it needs to stay upright without heroic compensatory efforts. The real-world impact of this is profound. Fewer sideways falls, which, as I mentioned earlier, are the ones that most often cause hip fractures. Better confidence walking, which means you're more likely to stay active, which creates a positive cycle of maintaining strength and mobility. And reduced stress on knees and spine, which means less pain, better movement quality, and greater independence overall. Falls are not an inevitable part of aging, but ignoring this muscle makes them far more likely. I've seen too many people accept falls as just something that happens when you get older, and it doesn't have to be that way. Yes, balance changes with age. Yes, reaction time slows down. But the single biggest modifiable risk factor, the one thing you have direct control over, is muscle strength, and specifically, this muscle. If you take nothing else from this video, take this. You have more control over your fall risk than you probably think you do. A few simple exercises done consistently can make an enormous difference. I'm not promising you'll never fall. No one can promise that. But I am telling you that strengthening your gluteus medius is one of the most evidence-based, well-researched interventions we have for reducing fall risk in older adults. If this helped you, if you learned something you didn't know before, do me a favor. Like this video so more people can find it. Subscribe to this channel for evidence-based health guidance that cuts through the noise and gives you information you can actually use. And most importantly, share this with someone you want to keep safe and independent. Your parent, your neighbor, your friend who's mentioned being worried about falling. This information could genuinely change someone's life. In the next video, I'll break down the biggest exercise mistake seniors make that actually increases fall risk. It's something I see all the time, something people think is helping them when it's actually making things worse. You won't want to miss it. Thanks for watching, and I'll see you in the next one.